Many thanks for inviting me to give this presentation, and apologies that I couldn't attend the event. I'm Veronica Grasso, and I'm Scientific and Program Officer at the World Meteorological Organization, and I'm also coordinating the State of Climate Services report. Today, I will present some slides that highlight the main findings from this year's State of Climate Services report that focuses on health. The State of Climate Services report, it's a report led by WMO, and it's a multi-agency report, so it's based on a partnership together with other UN agencies, research institutions, and the major climate finance institutions. This report this year highlights that climate change threatens to reverse decades of progress towards better health and well-being, especially in the most vulnerable communities. I will highlight the main findings from the report, and the following slide will then further provide details on each of these messages. So the world is warming at a faster rate than any point in recorded history, and climate change is threatening to reverse decades of progress to promote human health and well-being, especially in the most vulnerable communities. The good news is that health protection is a priority in almost all countries, but requires high-quality information to better inform decision-making. Climate information and services are fundamental to understand how and when health systems can be impacted, as well as the population can be impacted by climate, and helps to decide how to manage current and future risks. The report includes many examples of success, but it also highlights that the health sector is underutilizing such available climate knowledge and tools. At the same time, it highlights how climate services need to be further enhanced to fully satisfy the requirements of the health sector. A special section is devoted to extreme heat because the data highlights that it causes the greatest mortality of all extreme weather. Despite this, heat warning services are provided to the health decision makers in only half of the affected countries. Finally, it's important to highlight, and the report has a special section on this, that there is insufficient investment to improve the capabilities of the health sector and to fully harness the potential of climate services. So a transformational change is needed. The IPCC, the Intergovernmental Panel on Climate Change, highlights with very high confidence that future health risks from injury, disease, that will increase due to more intense and frequent temperature extremes, cyclones, storms, floods, droughts, and wildfires. Climate change impacts are not experienced equally, as you will see from the map that shows the observed human vulnerability to climate change, and it is anticipated that over 50% of the excess mortality due to climate change by 2050 will occur in Africa. Health protection is a climate policy priority in 91% of the national determined contributions, according to the World Health Organization. And top health priorities that emerge from the NDCs are vector-borne diseases, injury and mortality from extreme weather events. To fully implement and to put into action the NDCs, high-quality climate information is needed. There is immense untapped potential to apply climate services in the health sector. In fact, 74% of national meteorological and hydrological services that work with the health sector provide raw climate data. And on the contrary, only 23% of health authorities use climate data in their decision-making processes. This is largely due to the fact that tailor-made services need to be further improved and delivered, as well as co-developed together with the health partners. The data shows that extreme heat is the deadliest of all extreme weather, and furthermore, the impacts are underestimated. In fact, the heat-related mortality could be 30 times higher than what is currently recorded at national level. Almost 500,000 deaths per year are estimated to have occurred between the year 2000 and 2019, especially in Asia and Europe. Only 54% of countries are actually currently providing heat warnings to the health sector. It is clear that by channeling investment and boosting collaboration, there is a huge potential to go further and faster, and by enhancing the impact of climate science and services for health applications. Despite this, only 0.2% of the total bilateral and multilateral adaptation finance supports health-focused projects. The report includes many case studies, 19 case studies from around the world that showcase how climate and health action, which is integrated and is based on sound climate science, makes a real difference in people's daily lives. And this slide just shows a snapshot with 3 examples from Fiji, Argentina, and Europe, but the report includes many more examples of countries that have really made the difference by applying climate information and services on the ground. So I would like to thank you, and I wish you a very successful meeting.